There isn't one Medicare late enrollment penalty. There are three, worked out three different ways, and only one of them ever ends. Most people have heard of exactly one. 2 years late on Part B, and the penalty is 20% for as long as you have Part B. In 2026, that's about $40 a month on top of a premium you already owe, around $487 across that year. And it still isn't the one that behaves worst, because the smallest of the three, the one people wave away as barely worth worrying about, isn't a percentage of anything you pay. You could hold a drug plan that costs you nothing a month and still owe it. By the end of this, you'll know which is which and what each one actually costs. And more usefully, the ways out, because all three have exits and almost nobody mentions them. Start with what a penalty actually is, because the name misleads. It isn't a fine. Nobody sends you a bill for a lump sum. It's an increase to a premium you were going to pay anyway. It arrives folded into a number, and most people never see it as a separate line. There are three because there are three parts you can be late for. Part A, hospital coverage. Part B, doctors and outpatient care. Part D, prescription drugs. 3 parts, 3 penalties, 3 different sets of rules. There's one thing on your bill that looks like a penalty and isn't. If your income is above a certain level, Medicare may add an extra amount to your Part B and Part D premiums. That's based on your tax return from 2 years ago. An income adjustment, not a late enrollment penalty. And if a life event has lowered your income, you can ask for it to be reconsidered. Sign up for all of it on time, never let your drug coverage lapse, keep the paperwork that proves it, and none of them will ever touch you. For most people, on time means a 7-month window around your 65th birthday. The 3 months before the month you turn 65 that month, and the 3 months after. If your birthday falls on the 1st, the whole window shifts a month earlier. And if you're still working at 65, the deadline moves. We'll come to that. The trouble is how quietly drug coverage can lapse. Let's take them in order of how badly they behave. Quick word before we go further. This channel is educational only, not financial, tax, or legal advice, and I'm not a registered investment advisor. Everything here comes from the government's own guides, all linked below. Start with the one hardly anybody pays, and the only one that stops. Most people never pay a Part A premium. If you or your spouse paid Medicare taxes long enough, it's usually premium-free. Nothing to pay means nothing to be late for. But if you don't have that work history, you may be able to buy Part A. And if you buy it late, your monthly premium may go up 10%. Not 10% a year, 10% once. And here's what makes it unusual. You pay it for twice the years you were late. 2 years late, 4 years of higher premium. Then it stops. It's the only one of the three with an expiry date built in. Part B is where the arithmetic turns. Your monthly Part B premium can rise by 10% for each full 12-month period you were eligible and didn't sign up. Each. So 2 years late is 20%. 4 years is 40. 20% of what though? Of the standard Part B premium, $202.90 a month in 2026. That's where the $40 at the top of this video came from. 4 years late doubles that, about 80. Unlike Part A, this one doesn't expire. You pay it for as long as you have Part B for most people the rest of their life. But there's a detail in the counting that works the other way. It only counts full 12-month periods. The handbook works this through with a man it calls Mr. Smith. He signed up 27 months late. That's 2 complete years and 3 spare months. The 3 don't count. Mr. Smith's penalty is 20%, not 30%. That's the one piece of arithmetic that runs in your favor. And it's an accident, not a kindness. Which brings us to the one people dismiss. The Part D penalty only becomes possible once your first enrollment window has closed. After that, 63 days or more in a row with no Medicare drug coverage and nothing else that counts as creditable can trigger it. Creditable is the word everything after this turns on. It just means drug coverage expected to pay, on average, at least as much as Medicare's own. And your plan, or your employer or union, has to tell you every year whether yours counts. And the penalty itself is small. 1% for each full month you were eligible and went without. 1%. It sounds like nothing. It's why people skip drug coverage when they take nothing. So here's what that 1% is 1% of. Not your premium. A national benchmark figure Medicare sets and recalculates every single year. The handbook runs a second example, a woman it calls Mrs. Martinez. She went 29 months without coverage. Her penalty is 29%. That never changes. But the benchmark it's multiplied by went up the following year. So did her penalty. Same percentage, bigger bill. She did nothing. It grew anyway. Premiums move though. Part B's penalty climbs the same way. The real difference is what the percentage is a percentage of. Part B, the doctor one, is a percentage of the standard Part B premium, a number you can look up. Part D, the drug one, is a percentage of a number you don't pay and can't change. And you'll generally pay it for as long as you have Medicare drug coverage. Now the part almost nobody mentions. These penalties are not always final. If you're covered by a group health plan based on current employment, you may qualify for a special enrollment period. And it doesn't have to be your job. A spouse's counts. So does a family member's if you have a disability. That can mean signing up for Part A or Part B or both with no penalty at all. Not an appeal, the penalty never applying in the first place. But be careful what counts. For this, COBRA doesn't. Neither does retiree coverage. Current employment means somebody is still going to work. Drug coverage is the exception, and it catches people both ways. COBRA and a retiree plan can count as creditable for Part D, even though neither counts here. If your income and savings are limited, a Medicare savings program may mean you don't pay the Part B penalty either. For Part D, there are 2 more. Extra Help, the program for people with limited income and resources run through Social Security. While you have it, you don't pay the Part D penalty. Not a reduced one. None. If you've been told you owe a Part D penalty and think it's wrong, you can ask for a review, generally within 60 days of the letter. Picture someone who did nothing wrong, retired at 66, kept the drug coverage from the old job which counted as creditable the whole time, never went a single day without it. Then they join a Medicare drug plan and a letter arrives saying they owe a penalty. Not because there was a gap, because nobody has a record that there wasn't. That's what the review is for. The form comes with the letter and you bring whatever proof you can find, which is why the least glamorous way to avoid this penalty is the most useful. Keep your records, the letters from an employer, union, VA or TRICARE saying your coverage counted. Then tell your plan when they ask. That's the half people miss. All of it in one place if you're writing this down. Part A. Your premium may go up 10% once and you pay it for twice the years you were late. Then it ends. Only if you have to buy Part A in the first place. Part B. Your premium may go up 10% for every full 12 months you were late, and it lasts as long as you have Part B. Part months don't count. Part D. 1% a month of a national figure you don't pay, reset every year. And it can be reviewed, generally within 60 days of the letter. 2 things to do. Find the letter that says whether your other drug coverage counts as creditable and keep it. And if money is tight, ask Social Security about extra help and your state about the Medicare savings programs. So what's the real shape of this? 3 penalties. 1 expires. 2 don't. And the smallest isn't even worked out from a number that's yours. But look at what all 3 have in common. Everyone is triggered by a gap, a stretch of time when you could have had coverage and didn't, or a stretch nobody has a record of, an absence either way, of coverage or of proof. Which means the whole thing is decided by a calendar, the one part you can see coming. Most people find out about these penalties when the bill arrives. The ones who never pay them looked at the calendar first. Thank you for watching all the way to the end. It genuinely means a lot. If this video gave you something to think about, do one small thing. Subscribe to Retirement Decisions Desk. Every video here unpacks one retirement decision, and subscribing is how you'll never miss the next one. Take care of yourself, and I'll see you in the next video.